Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxtun Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County Board of Supervisors meeting will convene momentarily.
Okay, board to reconvene. Madam Clerk, please call the roll.
Supervisor Peters.
Here.
Supervisor Scribner.
Here.
Supervisor Maggard.
Here.
Supervisor Couch.
Here.
Supervisor Perez.
Here.
Good morning and welcome to the Tuesday, July 27th, 9 a.m. meeting of the Kern County Board of Supervisors. We'll begin today's begin today's meeting with a flag salute led by Sheriff Donnie Youngblood. Following the Pledge of Allegiance, please stay standing for a moment of prayer, silence, or meditation, whichever you prefer.
Place your hand over your heart. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Normally at this time I would be calling on Nick Colin, Director of the Animal Services Department, to introduce our Pet of the Week, but this morning we were informed that the owner has come to pick up his pet first thing. So we don't have a pet here today, but that's good news.
We're getting better.
Right? Okay, so we'll begin by considering the consent agenda. All items listed with a CA above the items are considered to be routine and non-controversial by county staff. Consent items will be considered first and may be approved by one motion. If a member of the public wishes to comment or ask questions regarding an item on the consent agenda, they may do so prior to a vote being taken. A member of the board may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. A member of the public may also comment on any closed session item. At this time, I will read the consent agenda item numbers, and that is items 1, 2, 4, 7, and 8 on page 2, items 9 through 16 on page 3, 17 through 21, as well as item 24 on page 4, and lastly, items 25 through 31 on page 5. Is there anyone in attendance that would like to speak regarding the consent agenda? Any questions or comments from the board? If not, I would entertain a motion to approve.
Motion on consent.
Second.
Please cast your votes.
The motion is approved. 4 ayes, 1 absent. Supervisor Perez.
Thank you. Okay, before we begin considering individual agenda items, I would like to note that Mr. Fernando Lopez is available for anyone requiring an interpreter to address the board and provide public comments during this morning's proceedings. So Mr. Lopez, would you please address the audience and in case your services are requested?
Si hay una persona que desea dirigirse a la Junta de Supervisores, han encontrado un intérprete para interpretarles.
Thank you. Okay, the board will now consider item number 3, proclaiming August 2021 as Child Support Awareness Month in Kern County. Here we go.
How are you?
Yeah, okay.
Nice to see you.
Good morning, colleagues. It is a sad reality that far too many of the children, not only in Kern County, but all across our country, are not cared for by their parent. they are not provided with the financial support and stability that is necessary. But we have a wonderful group of people who, come up closer if you don't, well, you might not want to get too close to me, I'm sorry. We have a wonderful group of people that work in the Kern County Department of Child Support Services who commit their lives to taking care of those children. And for the month of that we have coming up here, we have an opportunity to try to bring the public's awareness to a heightened level about what Child Support Services does. And because it's going to be August 2021 is Child Support Awareness Month in Kern County. They do many good things, and one of the, besides just helping provide financial support for these children, they also provide resources for the custodial parent of these children. And one of the ways that they do that is through their health and wellness fairs and the Ready, Set, Back to School backpack giveaway. And I'd like you to take some more time and tell us more about that, the incredible number of backpacks that you've given away and the other things that you do. So I am joined this morning by our department head, Elizabeth Chavez, from the Kern County Department of Child Support Services. And could I read you this proclamation about August, and then could you please tell us a little bit more about what's going to happen? So this is a proclamation from the Board of Supervisors that has proclaimed August 2021 as Child Support Awareness Month in Kern County, entered into our record by the signature of our chairman, Philip Peters, on this is the 27th day of July. So Elizabeth, I'm grateful for the work you do. You're a splendid example of the wonderful people that work in Kern County serving the public, and the department heads in particular that try to guide all the other employees that we have. So please tell us a little bit more about what's going to happen.
Thank you. Thank you, Supervisor Maggard, Chairman Peters, and board members. August is Child Support Awareness Month, and it's the month that we get to focus on the services that we provide and bring them out to the community. This year, the statewide campaign is Get the Facts. And Get the Facts is really all about what we really do. There's a lot of confusion in the community of who we are and what we do. And I really want to bring to the board's attention that we are here to establish paternity, parentage for the children, establish a child support order, collect and distribute the funds for the support, and we review the order whenever there is a change in circumstances. March of last year changed our lives forever, but my team still, even through that, continue to serve our customers. And so here are the facts of Kern County from March of 2020 through June of 21. We served over 17,000 customers in our office by appointment only. We also have a kiosk where customers can come in and make their payments, and we had over 7,000 customers come in during that time to pay. We also served over 152,000 customers via the telephone, because if you can imagine, a lot of them were in a panicked state. Either they lost their employment and they were the parent paying support, or they lost their employment and they were the parent receiving support. So we triaged a lot of phone calls. We also had the opportunity to open over 8,000 cases during that time. Our total collections that we distributed to families was $141 million. And when you think of the impact of that to our families in the community, that's a large amount. We also have a program where parents can negotiate to compromise their past due arrears, because some people have challenges that have happened in their past, and accumulating those arrears becomes a barrier for them. And our goal is really consistent child support payments. And so for state-owed arrears, we have a program called DROP. This last year, we were able to assist 87 parents that pay support to remove that barrier and begin to pay their consistent monthly support from that point forward. So as our custom, for August, we always host our Ready, Set, Back to School Health and Wellness Fair. I'm really excited that this year we will be providing those services at the Kern County Museum. So it's going to be an awesome event for the children, because they'll be able to come receive services, but also get to wander the museum. Some of these kids have never been there, and they have an opportunity to spend the day. We have some amazing partners this year joining us in CityServe, Dignity Health, and we're also going to have NASA there, so I'm really excited about that. They're going to bring some STEM things for the kids to do. Public Health will be there providing face masks for children for when they return to school. We also are going to have the Kern County Dental Health Network will be doing dental checks on children, and CAP-K will be providing free produce and fruits. I want to thank the following departments that are county departments, because it shows that as a team, when we put a goal and a call out, they step up. So I want to thank the airports, because they're providing little foam airplanes for the kids to have some fun out there. Also, Behavioral Health, who has been a very good partner for us. General Services, because they have helped us to coordinate the giveaways at the backpacks within your districts. As most of you know, we've been doing drive-through backpack giveaways, and they have coordinated that for us. Public Works, who has been a partner for us in providing a lot of the things we need to keep people going down the right path. And probation, the CAO's office and the Department of Human Services, and also the libraries. I want to thank each of my partners because they make the difference in the success of our event. And we're hoping to serve 4,000 children this year. That's our goal. Our team worked really hard to raise the funds for the backpacks, and we're really excited to be able to do this. And I hope you all can come out and see the event because it's going to be a lot of fun. Thank you.
Thank you.
Thank you.
Well done.
Thank you. Is there anyone in attendance that would like to speak on that item? Or any questions or comments from the board? Okay, seeing none, I would entertain a motion on staff's recommendation. Yes.
Yes, my motion.
Is there a second?
I'll second.
Please cast your votes.
The motion is approved, 4 ayes, 1 absent. Supervisor Perez.
Thank you. The board will now consider item number 5, public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda, but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making your presentation. Is there anyone that would like to address the board? Okay. Oh, I'm sorry, we do have one.
Good morning, everyone. I'm Adela Rosa, Policy Advocate with Leadership Council. I'm just here to share that Supervisor Scrivener, you had your constituents here last night to share with you what their needs were for the budget. And unlike other supervisors who asked for their contact information or who tried to follow up with them afterwards, you were silent the entire time. And we cannot take the silence anymore. We need a response from you. We'd like to know what your plans are to ensure that at least 1 or 2 of their needs are included in this budget cycle. So if you can please either contact me or contact folks directly, I'm more than happy to share their information with you. But we really do need to hear something from you. Thank you.
Thank you. Next speaker, please. Okay, seeing none, we'll now consider item number 6, board member announcements or reports. And I would like to begin by asking our Director of Public Health, Ms. Bryn Kerrigan, to give us an update on the COVID pandemic.
Good morning, Mr. Chairman, members of the board. Last week, I reported that we were starting to see some slight increases in our COVID rates here in Kern County. Unfortunately, that increase is starting to happen at a more rapid pace. 2 weeks ago, we saw a case rate here in Kern County at 2.1 per 100,000 people. Last week, I reported our case rate was 2.5 per 100,000 people. Exactly 1 week later, here today, we're at 6.6 per 100,000 people. Our testing positivity rate also continues to increase. 2 weeks ago, we were at 1.9%. Last week at 2.5%, and this week at 4.5%. We also look at the health equity positivity rate, which is the lowest quartile within Kern County. 2 weeks ago, we were at 1.6%. Last week, we were at 2.2%, and this week we're at 5.8%. 2 of our metrics would meet what the previous blueprint for a safer economy would be the red tier, while 1 is in the orange tier. When you compare us to the state, we're still doing a little bit better than they are. The overall case rate for the state is 11.2 per 100,000 people, and the testing positivity rate is 5.3 per 100,000 people. Most of the transmission that we're seeing here in Kern County continues to be amongst the unvaccinated individuals. In fact, as of Sunday and since January 21st, Kern County has had 18,742 confirmed COVID-19 cases. Out of those 18,742 cases, only 128 cases, or 0.7%, were in those residents who were considered fully vaccinated. Furthermore, there have been 1,433 COVID-related hospital admissions since January 21st, 2021. Less than 11 of those hospitalizations, or less than 0.8%, were in residents who were fully vaccinated. At the height of the winter surge, Kern saw our highest number of COVID-related hospitalizations at 453 patients, with 110 in the ICU. Exactly 1 week ago, we had 34 COVID-related hospitalizations with 7 in the ICU. As of yesterday, our hospitalizations increased from 59 to 80 in 1 day. Luckily, our ICUs aren't increasing quite as quickly. As of yesterday, we had 15. As of yesterday, Kern County's hospital system had 289 staffable available regular hospital beds and 55 staffable available ICU beds. Kern's ICU capacity is at 33.6%, and the San Joaquin region's ICU capacity is at 26.9%. We have reinstituted bi-weekly hospital CEO meetings, and we continue to maintain a staffing agreement with AMI to provide staffing for our alternative care site if needed. This site could be deployed within a week's notice. As of yesterday, 655,206 doses of the COVID-19 vaccine have been administered to Kern County residents. 316,231, or 41.9% of Kern's eligible population, or those who are 12 and older, have been fully vaccinated against COVID-19. Another 52,199 people have 1 dose of their 2-dose series, meaning 48.9% of Kern's eligible population is at least partially vaccinated. 66.5% of our 65 and older population are fully vaccinated, and 20.6% of our 12 to 17-year-old population is fully vaccinated. Reporting on reinfection of COVID-19 becomes difficult because sometimes we see people have persistent positive tests for months following their original diagnosis. Kern County has identified 173 individuals who have positive tests more than 90 days from their initial positive test. These are likely reinfections, however, could include some persistent tests as well. Yesterday, the state health officer issued an order requiring regular COVID-19 testing and medical grade masking in certain settings for unvaccinated individuals. These new requirements apply to acute healthcare and long-term care facilities, high-risk congregate settings, and other healthcare settings. Employees in these settings must verify vaccination status with their employer. Unvaccinated staff will be subject to twice-weekly testing in acute healthcare and long-term care settings, and unvaccinated employees in high-risk congregate and other healthcare settings will be subject to weekly testing. This order is effective August 9th, and facilities must be in full compliance by August 23rd. Just a point of clarification, there's been a lot of news reports that say that this is a vaccine mandate, and in fact it is not. It is a requirement that employees verify vaccination status, not that they must be vaccinated. Mr. Chairman, members of the board, that concludes my update.
Thank you very much, Ms. Kerrigan. Are there any questions from the board? Okay, Supervisor Couch. Oh, Supervisor Maggard.
You're okay. Thank you. You're welcome to go as well. Thank you. Ms. Kerrigan, please clarify the last point. If they have to identify themselves as being vaccinated or not, what is the requirement, if any, of those who are not vaccinated?
Sure. So there's no longer the self-attestation of you being vaccinated that's allowed in these settings. So you must show proof of vaccination status. And if you're unvaccinated, depending on the facility setting, you're tested either once or twice per week. The twice per week testing happens in hospitals or acute care healthcare settings and long-term care settings like SNFs, skilled nursing facilities, and all other facilities must be tested once per week if you're not vaccinated. You must also wear a medical grade mask or a surgical mask or N95 mask and not a cloth face covering if you're unvaccinated in these settings.
Are there any implications on settings such as this?
No, there are not.
I've read some articles about when people should be wearing a mask now, and if it's recommended that they should be wearing a mask. And it talks about high density areas. And some people might be concerned that this is a high density area, but from what I've read, a high density area would be more like sitting right beside somebody in an indoor stadium or riding in a bus that's full of people, or those that have to ride mass transit, subways and whatnot. So can you give any clarity to that about if there are any recommendations about what should happen in settings such as what we're in right now?
Absolutely, Supervisor Maggard, through the chair. The recommendations have not changed as of now. What we're seeing is a majority of the transmission is in those that are unvaccinated. The masking mandate requires that if you're in an indoor setting and you're unvaccinated, that you wear a mask. If you would like to take an extra precaution as a vaccinated individual, you're more than welcome to wear a mask. However, in a setting like this, where we're able to sit a few seats apart, physical distancing is no longer really something that they're looking at as far as transmission is concerned. They're thinking that if you are unvaccinated and you wear a mask, that is the protection that is needed. But if you're vaccinated, that you can be amongst other individuals that are vaccinated or unvaccinated with a mask, and that there is little to no risk for transmission.
Very good. That's reassuring. There is a perspective floating amongst the population out there that the new variants, Delta in particular, are not as serious as were the original variations on the COVID outbreak. So can you give us any sense of that?
Absolutely. So there's still a lot to be learned about the Delta variant. It is relatively new. We are seeing that it is much more transmissible than the original SARS-CoV virus that caused COVID-19. So that transmissibility does cause us some fear. There are still, what we're seeing, many increases in our hospitalization rates. We are still seeing people go into the ICU. We do feel that it is still just as serious as the original virus, and until we learn more, we need to consider it just as serious, and it could cause an illness just as severe as the original virus itself. So
if 1,243 people have been hospitalized since in the recent period that you've talked about, out of 18,742 cases, is that rate of hospitalization any different than it was with previous variants?
It's difficult to compare because the hospitalizations that we are looking at, the date that we started to see people be fully vaccinated or considered fully vaccinated in Kern County, which is why we chose that January 21st date, was after we were coming off of the last surge. So it's really difficult to compare because transmission rates were much higher in previous periods of time, but the hospitalization rate seems pretty comparable just by looking in a general sense.
I was just using my little iPhone calculator as I was talking to you. 1,243 out of 18,742 is 6.6%. I don't remember what the hospitalization rate was before, but it'll be interesting for us to track that as we go forward. And lastly, you might, it isn't just because people are fearful that I'm going to make this statement, but one of the articles I read also talked about how the people that are the most concerned about the Delta variant are people who have been vaccinated, which is contrary to what you would think the general population should be. But those people are, for whatever reason, blissfully but naively, wandering through life, about to get hit with that variant. But for those that are vaccinated, it's understandable that they might be more afraid because they have other comorbidities probably, whether that's obesity or some kind of obstructive disease or diabetes or whatever it is. So they have good cause to be careful with their lives. But isn't it also the case that those that are vaccinated already that are contracting, even though it's a small percentage, they are still somehow contracting the new variants? Isn't the effect of the disease on those vaccinated people diminished significantly by the fact that they've been vaccinated?
Yes, sir.
Yeah, so that's very reassuring for those folks. Okay, thank you. I appreciate your good work, and I look forward to your continued leadership. You've been outstanding, as have many, many other people. Thank you, Mr. Chairman.
Thank you, Supervisor Maggard. Any other questions?
Yes, sir.
Supervisor Couch.
Brent, is the data point that you brought up, the 173 positive tests among people 90 days after they'd already had a positive test, is that in response to the request that I made of you about a week ago?
Yes, sir.
Okay, well, thank you for that. So put that in perspective for me. We've had, and we don't know how serious those cases are or how mild they were. They're just 173 cases that tested positive 190 days after a positive test. Is that right?
Correct.
We don't know if any of them were hospitalized, or we know nothing other than that, the raw number. Okay.
Correct.
Is that out of the how many cases total?
Yes, I believe we're at like 118,000 cases or so. I don't have the number right in front of me of the total cases that we have.
But it's,
yes.
it's the total since this began and back last year?
Yes.
Okay. I appreciate that. Thank you.
Sure.
Thank you. Any other questions? Okay, thank you, Ms. Kerrigan. Are there any other reports or referrals from the board? Okay, I would just like to ask, in light of the tragic events over this past weekend, that we adjourn today's meeting in honor of Deputy Philip Campus. And with that, we will now move to item number 22 under the County Administrative Office, and that is the Distinguished Budget Presentation Award received by the Government Finance Officers Association. And for that, I will call on our CAO, Mr. Ryan Alsop.
Thank you, Mr. Chairman, members of the board. And what has become fairly typical in our office, the Government Finance Officers Association has notified me that the county's recommended budget for the fiscal year beginning July 1st, 2020 has received their organization's Distinguished Budget Presentation Award for the 5th consecutive year. Government Finance Officers Association is a nonprofit professional association serving more than 20,000 government finance professionals and is headquartered in Chicago with offices in Washington, D.C. This award was established in 1984 to encourage and assist all governmental organizations in the United States to prepare and publish an easily readable and understandable budget document of the highest quality that reflect guidelines established by the National Advisory Council on State and Local Budgeting and the Government Finance Officers' Best Practices on Budgeting. In order to receive this award, the recommended budget must serve as a clear and comprehensive policy document, financial plan, operations guide, and communications device. According to the Government Finance Officers Association, the award represents a significant achievement and reflects our county and your board's commitment to meeting the highest principles of governmental budgeting. I want to thank our department heads and their finance staff for their work and support, and I most particularly would like to thank Ms. Martinez of the CAO's office and her entire budget team, who are really just the best and brightest group of people that I've ever had the pleasure of working with. Let me be clear, we've been presented this award the past 5 consecutive years because of them and because of Ms. Martinez. I would like to recognize all of them. They're all here today in the audience, all of them for this significant achievement, and I want to ask them to stand up, and would you please join me in a round of applause for their achievement. Thank you.
Thank you, and well done. That's a great achievement. Is there any member of the audience that would like to speak regarding this item? Any questions or comments from the board? If not, I would entertain a motion to approve.
So moved. Congratulations.
Congrats.
Please cast your votes.
The motion is approved. All ayes.
Thank you. Our next item is number 22, again under the County Administrative Office, and that is the fiscal year 2021 through 2022 recommended budget discussion, and I will turn it back over to Mr. Alsop.
Thank you, Mr. Chairman, members of the board. I'm going to ask Ms. Martinez, our Chief Financial Officer, to present this item.
Good morning, Mr. Chairman and members of the board. Last night I presented you our changes to the preliminary recommended budget. I'm not going to go into all the details as I did last night. I just want to highlight a few items from last night's presentation. Again, I want to begin this presentation with reminding your board and the public about our budget process. And these are the 5 stages of our budget process. I want to make sure that the public is aware that they can always participate in this process, either through coming to any of these meetings that we have in front of you, or they can always contact our office. I know Mr. Alsop has always made himself available, and I always make myself available to the public. I am bilingual, I speak Spanish, and some people will tell you some days better than English. But I'm also available, so if anybody needs an explanation, all they have to do is contact our office. Again, we begin our process with a guideline that your board approved. We review our prior year numbers, our first estimate from the assessor's office, and we present your board with a guideline. Then we go to work with our departments. Our departments have constant communication with some of our groups. Public Works will tell you that they have significant communication with our community groups in Arvin and Lamont. After we receive the requested budget, we work with our departments, we look at their requests, we look at the mandates, and we present to you what we call a preliminary budget. Today, we're here at the adjustments phase. This is the time where we review year-end actual numbers and the revised estimate from the assessor's office. Yesterday, we presented for the public. Today, we'll do a brief presentation for your board and the public again, and we're hoping to receive some direction. And we will incorporate that direction and these adjustments in what we call the final recommended budget that will be available to the public 10 days in advance for review, and then we'll have our budget hearings at the end of August. Our preliminary budget was $3 billion. And one of the things, we talk a lot about our general fund, but I think there were some comments on other funds last night, and I want to emphasize the line under operating special revenue. That includes our roads department, our behavioral health, our child support, our Department of Human Services. There are a lot of programs that the county provides that are funded with state and federal money that fall under that line. One of the comments of our behavioral health department last night is that we don't provide substance abuse disorder services inpatient. And I contacted the department, and they're present here today, but I will tell you, we do have medical detox for adults. The state funds those programs a little bit different. We are the managed care for the county, behavioral health, and sometimes the states contract directly with providers. That's what we have in this case. I know they're working on trying to contract also with the state to bring those services. They also have residential adolescent services available, but they're not the medical detox. So there's a lot of detail that perhaps we don't present, but it's available.
Excuse me, Ms. Martinez, I think Supervisor Perez had a question.
Thank you, Chairman. Do we have medical detox beds right now?
For adults, yes.
For adults, not juveniles. How many do we have?
I will ask Ms. Allison Burrs perhaps to come back to your board with that information. I don't have it in front of me.
How long have we had medical detox?
I think it has been, we have 2 providers in the community that have been providing those services. I don't have how long, but we do have adult medical detox. They do contract directly with the state for medical, one of them, and the other one offers private insurance.
It must be fairly recent, though, also, because we've always had a big criticism about not having the detox beds. And that you can't even get into a residential without having been detoxed, which is traditionally a 3 to 5 day, even longer process to actual detox. So, we've had this huge gap, which makes no sense. And you're telling me that we have that. So if I'd love to talk to Ms. Burrows in my office, or even an email, just to give me a sense about that, because that's new. And I don't know that information has been disseminated or what that looks like, but I'd certainly like to know more about that. Appreciate
Absolutely.
you giving us that information.
So again, we fund our preliminary budget with a lot of funding sources. The majority of it comes through intergovernmental revenue. Those are funds both from the federal and the state level. Moving on to our general fund. This is the fund that funds most of our county operations. Our preliminary budget is $151.9 million, and it includes $363.9 million in discretionary revenue. We were originally projecting a decrease of $6.6 million from the previous year adopted budget, despite increasing our sales and use, hotel tax, as well as interest earnings. There was an overall reduction associated with the property tax, primarily as a result of the assessor's initial decrease in oil and gas properties. When we prepared the preliminary budget, in order to preserve essential public services, we balanced the budget using $16.8 million in net fund balance and $6.5 million in reserves, and those were included for operational needs. We are here today to provide your board with the closing fund balance as well as the final property tax revenue estimates based on the assessor's final assessment roll. Going back. The assessor's final assessment roll is $103.5 billion and results in an overall increase in property tax related revenue from the general fund of $11.9 million from the preliminary budget. And again, while this is good news, the assessment roll is less than the previous year's, the assessment roll growth, even though the number is higher, the growth itself is lower than the previous year. In addition, based on information provided by our sales tax consultants, we are increasing again our sales and use tax estimate an additional $2.7 million. We're also increasing our interest earnings and other revenue that combined with the property tax revenue results in a total discretionary revenue of $16.4 million. We closed the fiscal year 2021 with a net fund balance of $16.2 million. This amount takes into consideration projects that were incomplete at year end and need to be reestablished, and budget savings incentives. This carry forward includes the additional one-time discretionary revenue collected last fiscal year that we have been reporting to your board as part of our budget contingency plan. With those additional resources, we have provided your board with some proposed changes. I will not go into all of them. I just want to let you know that we have funding for critical positions both at the assessor's office, animal services, and the public defender. And those departments take the additional funding and determine where to use those resources. They are the experts. They know their departments best, and they allocate to the areas of the department where the need is the greatest. Looking at that table, you will see that at the bottom line is additional discretionary revenue that we're using toward operation. That's the amount that we identified in the preliminary budget. As you can see, the bottom number is $19.6 million, while our discretionary revenue is only $16.4 additional. So this means that we will use $3.2 million in one-time fund balance to cover the ongoing costs. Yeah, but we are confident that we'll be able to mitigate that budget gap with property tax growth in the coming year. As I mentioned, the county ended the fiscal year with $69.2 million. After the use of $3.2 million to mitigate the ongoing costs, we have proposed the following one-time costs for this resource. They're listed on your PowerPoint, and we also provide additional detail in the staff report. I would like to highlight to your board the $15 million for major maintenance and capital projects. We are proposing $6.4 million for parks improvements, including Casa Loma lighting, $1.5 million for park improvements throughout the county, improvements at Hart Park and Kern River campgrounds. The legally mandated projects include American with Disability Act and state mandated recycling requirements at county facilities. Energy efficiency and water conservation projects includes cost-saving projects for county facilities. The utility and major maintenance repair or replacement include elevator and heater and ventilation air conditioning repairs, fire system replacement, and additional funds for the replacement of the water tank at Lerdo. And finally, the preventive maintenance and reconstruction includes repairs for roofs of county facilities, including the much-needed roof replacement at Camp Owens. One of the items brought last night to your board was, how do we never have people from other areas of the county here asking for improvements? I want to assure you that there are needs across the entire county. We have, and if your board is aware, we have over 122 county service areas. Those are areas where the property tax owners have decided to tax themselves or have an assessment on their property tax bill to provide additional services such as lighting, sewer, paramedics, and other services. We, as a county, have an immense need across the entire county, and our departments allocate those resources to the best of their abilities. Sometimes they're mandated to provide a specific service in an area. Sometimes it's based on needs, and they continue to apply for grants. In fact, I know the Public Works Department have been working very hard in different areas of Lamar and Arvin, and there are approximately $9 million in projects, either in design or construction. They have also applied for a $6 million grant for flood prevention, and your board in the initial American Rescue Plan Act plan have allocated an additional $10 million for flood mitigation. As previously presented, we're allocating some resources, one-time resources to the retirement designation. I want to remind your board that we established a plan to mitigate the impact of the retirement cost increase on our services to our residents. Our retirement costs, I've been here at this working in the budget division since 2010. Our retirement cost was $177 million. For this coming budget, we're at $300 million. This is an ongoing cost that we have to pay year after year.
Elsa, what year was that, 177 million?
2010.
Thank you.
Your board has also approved the lease of a Kern facility that is much needed, and we are recommending setting aside funds for our public safety communication project. With this additional increases, the total balance in reserve and designation will be $446.8 million on fiscal year 21-22. As I mentioned last night.
So real quick, okay, gotcha. Oh, never mind, sorry.
Okay. As I mentioned last night, it is important to remember that most of the designations were established for a specific purpose, including those that I just mentioned. Our monthly cash outflow for the general fund is approximately $7.8 million. The Government's Finance Officers Association recommends a minimum of 2 months of regular general fund operating expenses in a designation, including the designations set aside for the much-needed capital projects. Our available balances in reserves and designations is approximately the 2-month minimum recommended. Our fiscal stability line of $40 million is only 20 days of cash coverage. Your board have approved many actions to provide stable revenue sources to the fire fund. The preliminary budget included $152 million in appropriations for the fire fund, and is funded primarily, as you see, by property tax, including the general fund property tax transfer approved by your board. The preliminary budget included funding for all firefighter positions. However, it required the use of $3.1 million in one-time resources for operational costs, and it did not include funding for station or equipment replacement. With the property tax increase and the additional funding from the dissolution of redevelopment agencies, the fire fund will have sufficient ongoing resources to cover the operational costs. In addition, they ended the fiscal year with $8.8 million in fund balance, and we are recommended that the $8.8 million be used to fund a portion of the estimated $15 million in capital replacement needs. Your board approved and funded last year from the general fund $10 million in capital purchases. The fire fund also has a designation, general designation and a fiscal stability that will help the department cover some of the operational costs or cost increases until such time as the agreements with the cities for discretionary fire services are finalized. And again, I want to remind your board of the schedule. We are available to the public, to the community to answer their questions or provide additional information. Our next scheduled board meeting will be August 31st. We will have budget hearings. That concludes my remarks, and I'll be happy to answer any question. We are seeking for your board comments or direction that your board would like to be incorporated in the final budget.
Thank you very much, Ms. Martinez. Supervisor Couch.
Thank you. This question is either for you, Elsa, or for you, Mr. Alsop. And it's because I had a brief conversation with Mr. Alsop before we started the meeting. One of the things we heard last night was, where is the money? Where has it gone? And you touched on it a little bit with the pension costs, but healthcare costs and our overall payroll. Since around the time you mentioned 2010, Ryan, you may want to go back a little further than that even. But can you, let's start with Ryan, and if you want to fill in a gap there. Ryan, why don't you I'd like you to just mention what you spoke to me about just before the meeting started, if you don't mind.
No, sir. Through the chair, members of the board. What doesn't get talked about and really needs to be talked about. There were several folks last night that talk about, where's the money going? In 2009-10, we were spending, this is the county's contribution toward employee retirement benefits. It's what the county pays. It's not what the employees pay themselves. What the county pays was $144 million. 10 years later, today, it's $301 million. So that's $157 million more every year that we're paying toward those costs than we were paying in 09-10. Obviously, this makes...
Can I underline that? That's not a cumulative number. That's $300 million per year.
Yes, sir.
Thank you.
In addition to that, our healthcare costs have gone from $85 million 10 years ago to $104 million today. That's a $20 million increase. We've also, the money that we spend on salaries, which is separate from benefits, has grown by $77 million in just the last 10 years, even though our workforce has decreased. We're spending money somewhere on salaries, the point to this is really, while we, we're trying to be smart about how we position ourselves to provide more regular cost of living increases. We have continued to sustain the elevation of pay bumps, which are 5% between bumps for county employees. We've continued to do that, and we have not laid anybody off. I can tell you there are many jurisdictions up and down the state, including the state itself, that laid employees off recently. They had to because they had their foot on the gas on compensation increases, and they wound up either having to furlough or laying people off. The state just hired back about 1,000, a little over 1,000 employees just recently. To your point, this is, if you want to know where our money's going, $157 million of it over the last 10 years increased is all being funneled toward employee pension costs. And when you add that $20 million of health benefits, you're up around $180 million. So it is challenging in an environment like that to sustain the regular pay bumps and regular growth in salary, to maintain employee levels, to also maintain the costs of benefits, while also trying to come forward with a meaningful COLA, which is why we are working collectively very, very hard to make some reforms in the way we compensate people so that people can expect to see their take-home pay increase on a more regular basis. I think it's a worthy goal and definitely a place we need to be in, but it's a heavy lift. We're working on it, and we hope to be in a situation where your board can consider that going forward on a more regular basis. And I think that will be a significant help to those employees that we have that are valuable employees here that find themselves at the very top step with no room for salary increases, some of whom have been in that situation for quite some time. But I think all of these numbers kind of put things into perspective relative to the challenges that we've been facing and why this has been so difficult.
I appreciate that. Thank you for that. Do you have anything you'd like to add to that?
No, Supervisor Kelly.
Okay, thank you for that. Appreciate your presentation. Thank you, Mr. Chairman.
Thank you, Supervisor Cash. Supervisor Perez.
Thank you. Elsa, I had a number of people last night frustrated that, quote, we are doing nothing in the community. I've got 3 projects, parks projects in the 5th that I think are consuming most of the parks money, which I can't say I feel guilty about given the historical disparity, frankly. However, it is compelling, and I'm curious why that information doesn't seem to be well known. It's not a criticism of you, but perhaps we need to really think about how we package this information, because it's absolutely outrageous. And it's just, I don't even know how to begin a conversation with people that say you're doing nothing in the community when we've got the kinds of millions of dollars lined up for projects or parks. It's just, it's a little maddening. So I think we need to brainstorm a little bit about that, maybe offline, because clearly, folks are getting their talking points either from people who don't know what they're talking about, a purely political agenda, or I'm just neglecting to communicate more effectively. I'll fall back on that last one because that's the one I can control or influence. So I just think we need to do a better job of that, because clearly people just are not aware, or some people are not aware, of the profound investments being made. Historically, no, I wasn't here, neither were you, so I can't answer for that. Neither can anybody else up here. But moving forward, I'm excited about those projects because they're competitive, they're not a given. We're out there, Christian Romo in my office is out at Potomac Park, gathering the residents, bringing various county departments to, think about circulation, traffic, speed bumps, the whole 9. I think we're incredibly engaged in that process, but we just don't always communicate it as effectively as we could. So I just wanted to put that out there for you, Elsa, and tell you how much I appreciate you.
Thank you, Supervisor Perez. Supervisor Scribner.
Thank you, Mr. Chairman. Mr. Alsop, we heard, I can't remember if it was last night, it might have been in a previous meeting, I think it might have been last Tuesday, where a member that was speaking about, a member of our assessor staff that was speaking about the assessment role, saying that it's the highest historically, et cetera. And in that same vein, talking about our inability thus far to provide pay raises in light of that. And I think that the number that I look at that is the most telling as far as the situation we're in is the 0.9% growth in our property tax that we saw this year versus a 2.8% growth. And so you see the assessment roll, it may be our highest yet that we've seen, but that rate of growth is quite a bit lower than last year and lower than it is historically. And so how do we reconcile a 0.9% growth with the increases in the cost of doing business that we're experiencing in pay and benefits and everything else that the county experiences? Can you just speak to that? I mean, how does that 0.9% growth impact our ability to make ends meet?
Well, Supervisor Scribner, through the chair, members of the board, and I think Elsa said some important things in her comments, and maybe I'll have her go back and kind of hit on that as well, but it's not good enough. We need to see, I think the last time that we had heard from the assessor in general on property tax growth, we were, in terms of growth over the last 5 years, we're dead last of all counties. I think we're number 58 in terms of year-over-year growth. Many of the counties around us that touch our borders have seen double-digit growth over that same period. And I think ours was, it was below 1%, I believe. So it's not good enough. And Elsa, do you care to comment and emphasize your point you made earlier?
Supervisor Scrivener to the chair. I think I want to rephrase a few numbers, though. It is very clear. Our assessment roll growth was significantly lower than the previous year. So to put this into perspective, how does that translate into property tax? When we finalized the preliminary budget, it included a reduction in property tax of, I believe, $5.2 million. This was based on the fact that we were expecting oil and gas to drop between 30 and 40%, and our other properties to grow about 1.8. With the final assessment roll, our oil and gas is still declining 24%, but our residential and commercial are growing about 4%. So how does that translate into property tax? There's a change of $11.9 million from the preliminary budget. So I want to make sure that we start with a -5 and we go to 11.9. So it's only a growth of $6 million. Our retirement cost for safety alone is $6 million. So that's where the money is going. That's where the resources are going. We have other costs increasing. I know everybody keeps talking about inflation. Inflation affects the county as well. We buy a significant amount of construction material for roads. Those are going up. So that means there's less resources to do more projects. So those are the kind of things that we have to balance when we hear that our assessment roll is the greatest or the largest that we ever seen. We have to compare it on the other side. What is the cost that is also going up?
Yeah, and that's precisely my point. And also, we heard a lot about the lack of pay increases, et cetera. But how many? I know you've had this number before, but there are many pay increases that have occurred in the county over the course of these years that are all additional costs for us, even though you haven't had across the board COLAs throughout the county. You have pay increases that occur, each and every week. So I don't know, Mr. Alsop, if you have those numbers at your fingertips at this time.
Supervisor Scrivener, I just happen to have them here. Members of the board, Mr. Chairman, I mean, these are numbers I've said before, and this is by no means to, and I don't think Supervisor Scrivener intends this, but this is by no means to take away from the importance of trying to get to a place where we can provide more regular compensation increases. But nonetheless, we have continued to provide employees with compensation increases to the best of our ability. We've been creative, we've worked very hard, and we've continued to try and a number of different ways to really, attract, recruit, retain our workforce. So just going back just the last 4 years, and I'm doing that because that's when I started here, just the past 4 years, 2017, 18. In that year, that was the height of the financial crisis we were dealing with, really. But we provided all county employees with a $1,000 retention bonus. It's something. SEIU members got that. We also provided 4 additional fully paid days off for all SEIU members. 4 additional fully paid days off. So we're being creative. We may not have the money to provide, but we're trying to be creative in providing some additional incentive toward compensation. We provided in 17-18 a 15% salary increase for nurse practitioner classifications and physician assistant classifications. And that year, in addition to what I just described, we gave 1,458 SEIU members a 5% adjustment in salary. In addition to all those above, that's the merit-based increase. In fiscal year 2018-19, which is the next fiscal year, we provided 4 additional fully paid days off for all SEIU members. We provided a 10% salary increase for over 500 human service technicians at the Department of Human Services. Your board provided between 5 and 25% salary increases for over 500 behavioral health employees in that year. Your board provided 15% salary increases for 35 public health and environmental health employees. Your board provided 10% salary increases for over 100 public works employees. In addition to that, we gave 1,548 SEIU members a 5% adjustment in salary. In FY 2019-2020, your board provided a 10% salary increases for 30 ag biologists inspectors. You provided 3 additional paid days off for all members and an 8.5% increases for 100 human services supervisors. In addition to that, in 2019, FY 2019-20, you gave this county provided 1,858 SEIU members a 5% adjustment in salary in addition to everything I just described. Lastly, 2020, in this current year, 3 additional paid days off for all members. Your board provided emergency paid leave for all non-essential employees for COVID-19 on your own, ahead of many other counties, ahead of the state, ahead of the federal government, along with child care reimbursement of up to $500 a month, along with a technology stipend of $75 a month during the pandemic. It's not the end-all be-all, but it's something. And I think it was meaningful for people, and it was ahead of where most other local governments in the state, well ahead of where they were. And this year, so far, you've provided 1,828 SEIU members a 5% forward adjustment in salary to date. So that is, almost 7,000 5% bumps in salary over the past 4 years for SEIU members, meaning many SEIU members received multiple 5% bumps in salary. We're doing what we can, where we can, as creatively as we can in light of everything that we just talked about. We would like to get into a position where we are providing more regular compensation increases for all of our employees on a more regular basis, and we're working toward that effort, as you well know, members of the board, at this very time. So I hope that, I'm sorry for all the detail, but I hope that answers your question.
No, it does, and I think it's important for us to continue to point that out. Obviously this board wants to do more. Each and every one of us are committed to that, and that's what we've tasked you and your staff with, Mr. Alsop, is to get us to a place where we're able to provide those cost of living increases. But we are forced to balance budgets, and all those reserves that people speak about are all there for very important purposes that we know we're going to have to pay for. And if you pull money out of those reserves, then where is it going to come from? We can't print money. That's the situation we're in, and I appreciate very much Ms. Martinez and Mr. Alsop, all of your staff that work so hard on this. Thank you, Mr. Chairman.
Thank you, Supervisor Scrivener. Supervisor Maggard.
Thank you, Mr. Chairman. I just want to reiterate something that was just said. You are correct, Supervisor Scrivener. We cannot print money, nor would we be in a position to do all that we have done if we were imprudent and spent those reserves on ongoing costs when those reserves are finite one-time dollars that are available. So we are only in the position we are in because we have held the line to make sure that we have the funds available to do what we've been able to do. And I'm very proud of that. And the taxpayers of Kern County, while it was alluded to last night that the taxpayers of Kern County are here demanding this, that is not accurate. We had an employee union group here last night demanding something for their bargaining group. The taxpayers of Kern County are grateful that we have done what we have done, and I just want to make that ought to be made clear to everyone. Mr. Alsop, could you reiterate one more time there was something else that was very telling in the conversation last evening, and that was the fact that we have attempted to indeed give a cost of living increase to those employees. Could you please reiterate what you said last night about that?
Yes, sir. Through the chair, members of the board, I'll just, because we have ongoing negotiations with multiple bargaining groups, but in terms of SEIU, we have a tentative agreement in place with the SEIU leadership. Your board set aside in designation a little under $26 million in ARPA funding to provide premium pay for essential workers. Our TA reached with, and your board did that in June, very early on, because you felt it was a priority. It is what that money was intended, part of what that money was intended for when it was passed in Washington, and your board set that aside. Our TA is with SEIU on that to provide all of their members with $3,000 one time in premium pay, which, if agreed to ultimately and approved by them, will be paid out to all of their members at some point very early on in the fall. In addition to that, we've provided SEIU leadership last week a proposal that includes a plan for a COLA and compensation increases for every single one of their members. They said that they won't be able to meet with us to discuss it until August 17th. So we'll look forward to meeting with them August 17th to talk about that.
Thank you, Mr. Alsop. I appreciate that. Well, one last thing. This is on a very personal note with you, Elsa. Last night when you stood to give us your report, you very poignantly and I think sensitively explained the circumstance that we all find ourselves in. When you explained, and maybe you should say it yourself instead of me recapping what you said, but when you explained that it is our duty to continue with the business of the people, to provide a budget and for the hundreds of thousands of lives who benefit from services from this county, it is our duty to continue with that. That doesn't diminish the fact that we are in the shadow of a terrible tragedy that cost the life of Deputy Campos. Changed the life, and his family will suffer forever from that, and changed the life forever of Deputy Guerrero, or the tragic loss of Viviana Ramirez and her two sons. So you very effectively laid that out when you began yesterday, and I'm grateful that you did that, because it is the shadow under which we are all doing this as we proceed. So I just appreciate you, Elsa.
Thank you, Supervisor Maggard. Mr. Alsop, just out of curiosity, or maybe this is a question for Elsa, but the reserves that we have, you said is enough basic cash on hand for 23 days of our operating budget. Is that correct?
That will be our fiscal stability reserve, which is $40. Our overall reserves in the general fund, excluding the communication project and the corner project, is 2 months cash flow.
Okay, great. Thank you for clarifying that. Are there any other questions or comments from the board? Okay, thank you, Ms. Martinez. I appreciate it. Are there any members of the public that would like to speak on this item?
Mr. Chair, members of the board, Michael Turnipseed, I represent the Kern County Taxpayers Association. I think it's safe to say that no non-governmental person or organization monitors what you do more than we do at Kern Tax. It's communication. But an important part of communication, and let's be frank, is local journalism, not only here but nationwide, isn't what it used to be. The coverage of your meetings used to be much more detailed than it is now. Many weeks we're lucky if you even get an inch in the paper telling people what happened. I review every meeting's agendas, and I attend your meetings one way or the other, either in person, virtually, or on YouTube video. But grants and funding don't happen once a year in the budget process. You get grants all year long. How does the public know when you get a grant? If you don't tell them, they're not going to know. And there's not one communication method, because I watch one TV station and listen to one radio station, and everybody does the same thing. So the people last night don't even begin to know all the things you do. And if there's anything that I've learned in the last few years, is the city manager puts out an info piece every Friday, and it's all basically fluff. It's pictures. Oh, we redid this parking lot, or we put this new thing in the playground, and it's just a puff piece. And granted, the reception list is probably 50. Well, in your case, you need to have a reception thing of 900,000. So your clients, the people you represent, actually know what you're doing, because 99.9% of the people don't. You have a communications department. Each department now has PIOs, but that doesn't translate to what the average citizen knows about what you're doing. And I was great comments by Supervisor Perez. I didn't know that. I didn't know this. I didn't know that. And I think if you don't know it, nobody's going to know it. So tell your story and make sure people hear it, because nobody else will. Thank you.
Thank you, Mr. Turnipseed. Mr. Alsop.
Thank you, Mr. Chairman. It's good to see Mr. Turnipseed here and walking around. He's looking good. Mike, I'm known, I get questions in my neighborhood, even from people that I have dinner with pretty regularly. How's the city? It's just, you can never tell your story, I guess, enough, but I do want to acknowledge very important points that Mr. Turnipseed makes, and it's really a challenge for not just Kern, but I would, in my experience, any local government is, getting information out to the public. This is why we have a very good countywide director of countywide communications that we've hired. We are transitioning in a way that, continuing to build on our best practices to provide the public with information. We are really, for the first time ever, starting to do more with our internal communications with our employees, letting them know what the Board of Supervisors is doing any given Tuesday, what you're approving, what you're debating, providing links to watch those videos. We're doing the same thing with local media. And the feedback that we've gotten both from employees and members of the local media on kind of detailing out what you're doing every Tuesday, which we weren't doing before, has been tremendous. And it's actually led to an increase, an uptick in coverage, in reporting on things that wouldn't normally get covered, important things that wouldn't normally get covered, investments that your board's making in the community on a variety of different levels. So I appreciate what Mr. Turnipseed, he's right, and we will continue to take that to heart and prioritize making sure we're doing our very best on engaging with the public and telling our story.
Thank you, Mr. Alsop. Any more public speakers?
Thank you. My name is Julie Juarez Teja, Community Relations Director for the Alzheimer's Disease Association of Kern County. So on that note, I'm going to tell a little bit of our story of how we've benefited from your support. So we just want to thank the Board of Supervisors for the support of our mission, serving the families of Kern County that are on the Alzheimer's journey. Currently in Kern County, we have over 11,000 individuals that have been diagnosed with Alzheimer's, and that's what the diagnosis. It's a disease disease that is very hard to diagnose. So there's many more families and individuals that are dealing with this disease. But on behalf of our organization, and thanks to your support and believing in our organization, we've been able to support the families and make that journey a little less difficult. So I'm just going to share a little bit about what we did over last year during COVID. We did, like many other organizations and businesses, had to close our doors. We closed our doors for 8 months, not able to provide our on-site day program. But what we were able to do is quickly pivot our services. Our team got together. We were retrained. We sent our team out into the community. We offered emergency in-home care to our families. We provided activity kits that we would leave at the doorsteps of the individuals. We provided wellness bags for our family caregivers. We provided food, hygiene kits, PPE supplies, warm meals, because some of our families, they didn't have the need for groceries. They had finances for that, but they were just completely exhausted and weren't able to even cook their own meal because of the obligation of caring for their loved one. So we provided just hot meals for them so they can get through the day. That resulted in, and again, just during this 8 months of our closure, over 1,300 hours in emergency respite care that we provided. We offered over 400 virtual crisis counseling, and that's where people will call and say, I'm at my end, I need help, I can no longer take care of mom, dad, husband, wife. What can I do? How can I get through this? We offered 100 meals that we delivered to our families, and over 200 wellness kits. We provide an annual Caring for Caregiver conference that's free for caregivers, and so last year that conference turned virtual, and that was one of the best things that came out of COVID for ADAKC is that we were able to provide a virtual conference. We had over 10,000 individual touching points where we were able to reach over 10,000 individuals through this 3-day virtual conference, more than we've ever been able to do before. These are families that were not able to leave their homes, but were still able to tune in and receive support and resources. Out of that, 95% of our families have said, because of those services, during that time of our closure, they've had reduced feelings of anxiety, reduced feelings of depression, and improved coping skills with their loved one and the disease that they're all facing together. So those are huge impact. And we just want to today be here and say, you are making a difference out in the community. We see it. Our families are feeling it. We just want to thank you for your support and your continued support of ADAKC and helping the families of Kern County on the Alzheimer's journey. So thank you.
Yeah, thank you very much. I know numerous people whose lives have been impacted by Alzheimer's, and that's something I wouldn't wish on anyone, and I know you guys are making a big difference, so thank you very much.
Thank you. Thank you.
Are there any other members of the public that would like to speak?
Good morning again. Emma de la Rosa, Policy Advocate with Leadership Council. I'd just like to add a little spin to what Mr. Turnipseed said in terms of communication, which is for all of you to work directly with community-based organizations like we have been asking for the past few months. We ask that you all participate in a public participatory budgeting process. We've asked for it in the past. And if you had that in place, then maybe we wouldn't have so many questions and maybe you would feel more comfortable in terms of communication. But we do encourage you all to create some type of model, and if you need help, we're here to support. We're never just asking you to do things just because. We're here to support if you need the support. But maybe we can explore this type of model for the next budget cycle, where we talk about the guidelines in a more public manner and ensure that everyone knows that the guidelines are out, and that maybe if you want some departmental requests, that this is the time to speak to department heads. All of that would be super beneficial and helpful for all of us in order to be more proactive and effective in our advocacy efforts. It seems like all of you, except for maybe Mr. Scrivener, because he doesn't respond to us, are willing to hear us out. And we are here to share with you all what we want to say, and we hope that you all are willing to work with us so we can see some improvements in the community. In addition to that, last thought is, I understand that, with the presentation that Ms. Martinez just shared, which is great, thank you. there's obviously needs for everything, but a pattern that I see a lot when it comes to disadvantaged communities is that the resources are solely dependent on grants. And I think that's the disparity that is super, highlighted there. We don't really see a lot of the investment coming from the county. If it's not grants, then it's nothing. And so maybe making a shift in that could be helpful in the community, trusting you all and seeing you really as your representatives. Thank you.
Can I say something?
Thank you. Supervisor Perez.
Thank you so much for your passion and your concern for the community, really. We live in a desert with 8,200 square miles. A huge portion of that is rural, just like much of the country. We would need tens of billions of dollars to pave over the desert, if you will. So we have, like any entity, including our own households, limited money and limited opportunity. One thing I always say to groups like yourself who are passionate and clearly care so much about the community, that funders fund friends, right? Funders fund friends. It's a human principle. Government, outside of government, it's just the way that human beings operate. And I love your idea about getting together and understanding the larger process. I think part of what we fail to do in government, we're so bogged down with the minutia of government, it would just really blow your mind. And that's not your fault, and that's not a great excuse, but it's a reality that we just don't communicate as effectively as we could. And we just don't. But it will really blow your mind to know the amount of work that's happening for curb and gutter and parks and the built environment. I mean, I have never seen such political response from this board, and also momentum to look at traditionally poor areas, which is most of Kern, frankly. I mean, this is a disadvantaged community entirely. It is a very small number of people who do well here. The vast majority, really struggle. So the need is in the tens of billions. We will never have it. It is a desert. It isn't intended to be populated maybe even by this amount of people. So we are in constant struggle, right, in a modern, developing, built environment to balance the realities that we are poor, that we are low-skilled. We are the finest people in America, in my opinion. It's why I'm still here. But nonetheless, those are realities that are profound. But I would love to sit down with you and help you understand more what it is we're doing, because the lines of funding are so confusing. The whole thing's just so confusing, the minutia of it. And clearly, we're not doing as effective as a job as we could. But I want to thank you for your passion and your courage to come down here and challenge the power structure. I don't think that's an easy thing to do. But also, there's a lot going on that I think would really help the conversation. So I want to, put that out there and say I'm open to that. But I ask that you remember a basic principle that funders fund friends, whether we like it or not. And it really behooves us to, be wise in our partnership moving forward. So really, hats off to you for your advocacy.
Thank you.
I look forward to the process together.
Thank you. And that does sound a little bit like nepotism, which I think we do need to try to, stray away from and ensure that everyone gets access to the resources, regardless of whether or not somebody likes each other. We have to do it for the needs of the community and for the fact that some people are drinking poisoned water every day. But I really appreciate that, and I look forward to speaking with you.
Well, I'll tell you, it's not nepotism, and that's not what I said. So I need to clarify with you so you understand. Human beings build partnerships. Right. We are political animals. All of us are. It's our nature. And the way in which we devise our political structures is different for everybody, right? I mean, we're different people. We come from different places around the globe. We come from different cultural, socioeconomic backgrounds. Human beings, by nature, develop bonds and move momentum in a direction that makes sense for them. Right, that feels safe, it's just what human beings do. So, nepotism, hiring your family members in your office or funneling, that's a very different thing. What I'm trying to convey to you is I think we'll get further as friends. I think we'll build more momentum and that we'll understand the process better. If we sit down and go, okay, we're different, yes, you play a different role than I do. We'll never play the same role. That's okay. That tension is a good thing, in particular when you have a line of communication that's open and when you're, realize that you have to compromise in life. But as a principle, you know, funders fund friends. I always think to myself, okay, am I going to get farther here with honey here, or with you get my point, right? I'm not saying roll over. You can't. Not in the position that you and I were born into this life. We can't. We'll be ineffective. So I appreciate you, and I don't want you to pull back. I just want to tell you, you know, there's ways in which, you know, we can really make some magic here, you know, but as a principle, you know, we need to just do this process a little better, and that includes me first. So I'm offering that to you.
Thank you for clarifying. I appreciate that.
Thank you.
Thank you.
Thank you. Are there any other public speakers? Okay, seeing none, I will bring it back to the board for any other questions or comments.
Motion to receive and file.
Please cast your votes.
The motion is approved. All ayes.
Okay, having no more items to consider in open session, I will entertain a motion to adjourn to closed session to consider County Administrative Office Item 32 and County Council Item 33. Okay, thank you. With that objection, we are adjourned in memory of Deputy Philip Campus.
One day, your business gets a call about being listed in a business directory like the Yellow Pages. They tell you it's free, or it's just a renewal. But before you know it, a bill arrives. It was a scam. They say you agree.